Well, my inspiration for pursuing medicine came from my grandfather. My grandfather and I were very close when I was a little girl growing up, and we frequently sat on the porch talking about what I might choose as a career. And we talked about me going into law because in the area where we live, we didn't have lawyers, we didn't have physicians either. And especially we didn't have people of those professions that looked like me. And when I was 12, my grandfather suffered from a stroke. And during that time, I spent a lot of time at his bedside assisting. He was at home and I would bring him food, I fed him, and we talked a lot during that time. And he said, "You will make a great doctor. And I think you'll probably be a better doctor than you would a lawyer." And I was just so thrilled with being able to be a part of his care until he passed away. And there was just something about my time with him that just prompted me to continue on this pursuit for medicine. And I never thought about law after that time. So at age 12, I knew that I wanted to be a physician. When we look at the disparities of women in medicine, we see disparities along gender lines in promotion, in leadership position, some disparities in terms of compensation. We don't see the disparities of women entering medical school because if you look at our medical school, this year we have more women than men. But if history proves itself, what will happen is that for those going into academia, and if those in that particular class start at the same time and enter as assistant professor, the men will progress quicker to the professor level than the women. And that is a major disparity. And I really feel that we have to start working on that early and begin to empower women to take their rightful role, I call it. And as a leader, a female leader and a woman of color, I feel strongly that I need to be on the front end of that with policies, with bringing in those programs to get women prepared to do all of the things that they need to do to get promoted, encouraging women to use their voices to make sure that they are not paid differentially and to speak up. And I think that when we begin to do those things early, then women feel that it's the expectation that they are a part of that rank across leadership, and encouraging more women to enter into leadership and encouraging them early in their career. And when I say early, I'm talking about as medical students. I frequently sit with the medical students and talk to them about leadership at the place where they are in medical school, that they should take on a leadership role. And sometimes students and faculty members, they may bring something to my attention that they want to change. And I quickly say, well, yes, why don't you lead that effort and make a change? And that's sort of the way I grew up. in my career and working with my mentor is to be a part, be the change that you want to see. And I am very committed to working with women in those regards to make sure that they take their rightful role in action. As a woman in medicine, I can talk about the challenges throughout my career, as well as sometimes currently. And I tend not to really see them as major challenges, but sort of hurdles that you have to cross. And I think that in my career, some of the hurdles that I faced included times when I may have been passed over for a position or a committee membership or chairship of a committee that I really felt that I should have gotten. And when those things happen, and have always been, my parents would say since I was a little girl, one, to ask questions and to seek out truth for myself. So I was always one that would approach the decision maker and ask them to help me understand why I wasn't chosen for this, and began to speak to those issues. And that's how I've always dealt with the challenges. Growing up as a African-American female in medicine and elsewhere, my mom always told me that I would have to work twice as hard to get half as much. And I always wished that I didn't have to say that to my daughters, but unfortunately I had to say that to my daughters as well. But the other thing that my mom said to me, that do not give anyone permission to diminish you. And when you give people permission to diminish you, then you lose your position in life to do what you want to do. And I took that to heart, and that is in part why I often speak to those challenges when they occur. And I've had those challenges. I might say that as a female minority leader, there have been situations where I might present an idea and it's not heard, and a male presents the same idea and someone said, good idea. And I would always jokingly said, I think it was a good idea 5 minutes ago as well, in a joking way, so that they know that I didn't miss what just happened. And in meetings with other male leaders, when they do things, I tend to call it out, not in a mean way, but sometimes in a very joking way. Now I may say, well, please don't mansplain me. And if you do that enough, people then sort of take a step back and they stop doing those things. And I find that that's a sort of easy way to address it, as opposed to me getting all upset and losing my balance because I'm upset by what's happening. Well, when I think about my field, I think of it from several ways. My field as a physician, as a leader, as an administrator, I will start off by saying to women that you should follow your passion, first of all, and allow your passion to lead you. And even when you follow your passion, other things may come along your path. And when things come along your path, pay attention to them and seize opportunities that are presented to you. It's never going to be the right time, and you're never going to be fully prepared. No one's fully prepared. But if you're willing to step up knowing that you have the skills, you have the confidence, and where there are gaps, you will find out how to get the information, and you will have members on your team, hopefully, that are smarter than you, that will be able to assist you in doing things that you will do well. Set goals and objectives and forge forward. Be that voice of the voiceless and be willing to speak truth to power. Be willing to change those things that you would like to see change. And a lot of it takes audacity. And I feel that as a woman, there's just nothing that you can't achieve, because we've always had to struggle to find our way in society. We've had to, sometimes we were pushed aside and we had to get back on track. And we've been through some of the challenges that you talked about earlier, and we've overcome challenges. So given that kind of history, I just feel that there's not much that we can't do. And I'd say forge forward, have great mentors, seek many mentors, because one mentor doesn't fulfill everything that you need. And you may go to one mentor for one group of things and another mentor for other things. I remember having a mentor, and she still is my mentor, and she will tell you right away, Deborah, I can't mentor you on negotiating your salary. You could mentor me on that. And I knew that. So I would never talk to her about salary issues. I would go to someone else. And I would also say, choose a variety of mentors, male, female, mentors of color, different backgrounds, because all of these people give a different spin to things and a different bend to things. And having that diversity allows you to negotiate any space that you're in, because you begin to get experience with all kinds of people coming from all vantage points.